Every 5 seconds, someone in the world is diagnosed with diabetes, and every 10 seconds, someone dies from it. It's one of the fastest growing diseases in human history, and yet most people still don't really understand what it is. We think of it as a sugar problem, but that's only the surface. Diabetes is not just about eating sweets. It's about how our body uses energy, how our cells communicate, and how our lifestyle interacts with our genes. It's not a punishment. It's a signal that something inside us needs balance again. Your body runs on glucose, the simplest form of energy. To move that glucose from your blood into your cells, you need a key called insulin, produced by a small organ called the pancreas. When this system fails, when insulin is missing, or when your cells stop responding to it, glucose begins to build up in your blood. And that's where the damage begins. There are 3 main types of diabetes, and each one begins for a very different reason. Type 1 diabetes can appear at any age, in children, teenagers, or even adults. But it most commonly begins in childhood. It does not happen because of sugar, junk food, or lifestyle. It happens when the immune system attacks and destroys the insulin-producing cells in the pancreas. Doctors still don't know the exact trigger, but it's a mix of genetic risk and environmental factors like viral infections. Type 1 cannot be prevented, and there is no prediabetes stage before it. Once the immune system starts attacking, it progresses quickly. People with type 1 depend on insulin for life, and they show incredible strength every day. Type 2 diabetes develops slowly over the years. Here, the body still produces insulin, but the cells stop responding to it. A problem called insulin resistance. This type is strongly linked to poor diet, lack of movement, excess weight, chronic stress, and sleep deprivation. But genetics still play a major role. If one parent has type 2, your risk increases. If both parents have it, your risk can rise up to 80%. But remember, genes load the gun. Lifestyle pulls the trigger. With healthier habits, people can delay or even prevent type 2 for decades. Gestational diabetes appears only during pregnancy. Pregnancy hormones interfere with insulin and temporarily raise blood sugar. It usually disappears after birth, but it increases the mother's future risk of type 2 diabetes and the baby's risk later in life. There is also prediabetes, which is not a type of diabetes at all. Prediabetes simply means your blood sugar is higher than normal, but not high enough to be called diabetes. It is an early warning sign only for type 2 diabetes. If ignored, it can turn into type 2, but if caught early, it is completely reversible with better diet, movement, weight control, and proper sleep. Prediabetes is your body's first alarm, the chance to turn everything around before diabetes begins. The warning signs are subtle: constant thirst, frequent urination, tiredness, unexplained weight loss, blurred vision, and slow healing wounds. Often people don't notice until it's advanced. That's why testing is vital. Doctors confirm diabetes through a few simple tests. Fasting blood sugar. Diabetes is confirmed if the blood sugar level is 126 milligrams per deciliter or higher. HbA1c, your 3-month average, 6.5% or above means diabetes. Oral glucose tolerance test. After drinking a glucose solution, a 2-hour value of 200 milligrams per deciliter or more confirms diabetes. And these cutoff values are the same for teenagers, adults, and the elderly. Age doesn't change the diagnostic ranges. Only infants and very young children follow different management targets, but the diagnosis itself stays universal. If diabetes runs in your family, don't panic, prepare. Know your numbers. Get tested every 6 to 12 months. Genetics is not destiny. It's an invitation to act early. Once diagnosed, life doesn't end. It simply changes rhythm. Managing diabetes isn't just about medicine. It's about balance between food, movement, sleep, and stress. A diabetes-friendly meal isn't a punishment, it's colorful, full of life. Vegetables, lean protein, whole grains, and healthy fats. The key is carbohydrate awareness. Carbs aren't enemies, they're energy. But you must learn how much, when, and what kind. That's where carb counting comes in, a tool that helps you match your food, your insulin, and your activity. Exercise is one of the most powerful medicines. When you move, your muscles act like sponges, pulling glucose out of your blood without needing more insulin. Just 30 minutes of walking a day can lower your blood sugar and improve your heart health. Even a short 10-minute walk after each meal makes a difference. Sleep and stress are silent players. A single night of poor sleep can cause temporary insulin resistance. Chronic stress releases cortisol, a hormone that raises blood sugar even if you haven't eaten. That's why mindfulness, rest, and calm are part of diabetes care. Your mental state shapes your glucose levels more than most people realize. Managing weight is another pillar. Losing even 5 to 10% of body weight can restore insulin sensitivity and, in some cases, reverse early type 2 diabetes. It's not about looking thin, it's about helping your body remember how to listen to insulin again. Technology has revolutionized management. Continuous glucose monitors, small sensors that track blood sugar in real time, show how food, stress, and activity affect you. Insulin pumps and smart pens make dosing more precise. Some advanced systems even act like an artificial pancreas, automatically adjusting insulin throughout the day. But unmanaged diabetes can quietly damage the body over time. High sugar acts like acid, corroding blood vessels and nerves. It can lead to heart disease, stroke, kidney failure, blindness, and nerve pain. Many patients lose sensation in their feet. A condition called diabetic neuropathy, and simple wounds can become dangerous infections. Regular foot checks, dental care, and eye exams save lives. Still, diabetes doesn't always lead to tragedy. Scientists are already testing stem cell therapies, islet transplants, and gene editing that could one day restore natural insulin production. The cure may not be here yet, but hope is no longer distant. When you visit your doctor, ask questions. What should my blood sugar targets be? What's my HbA1c goal? How often should I test? What warning signs mean I should seek help immediately? Understanding your own body makes you your best doctor. In the end, diabetes is not just a disease of the body, it's a story of adaptation. It teaches patience, discipline, and awareness. And on this World Diabetes Day, we are reminded that millions fight this battle every single day, quietly, courageously. Diabetes doesn't have to define life. It can redefine how we live it with awareness, with compassion, and with hope. Because when it comes to diabetes, knowledge isn't just power, it's prevention.